information, knowledge, and wisdom. And I've had maybe 2 or 3 physicians in my life that seem to know things in a very intriguing way without being given much information. They kind of lived in the Yoda level. And the dragonfly, unfortunately, lives at the opposite end of the spectrum. So this is an interesting space to begin to talk about how we get data and what it really means. Probably the most important formula that I've ever come across. I use this almost every day in almost everything that I do. The value of something equals its relevance times its validity divided by the work in performing that task. And remote monitoring is a very interesting space. It sounds like it's great to have blood pressures and heart rates streaming from everyone's home, but what's the relevance of that data and how valid is it? How do I know whose it is? And what do I do when I get a stream of blood pressures all day long that some of them are abnormal? What do I then do? So we need to, as the intelligentsia on this side, figure out ways to enhance the value of the information coming out of the remote monitoring space, because if you don't follow the formula, if the relevance and the validity of that data is questionable, although the work is low, streaming data from someone's home is less work than moving them to an office or a hospital, you violate the formula. So value is an interesting concept to consider in remote monitoring. This is the current delivery model. We bring patients from their homes to clinics and hospitals. That's a centralized delivery model. But financial services is inverted. Doctors' offices are doing billing and things in a decentralized manner. This is an environment of delivery that can't be sustained. As costs rise, this is a very expensive and efficient model. And home remote monitoring allows us the paradigm to start to invert this process into the opposite. We want to bring technology and specialists to the home, which is decentralized delivery of care, and centralized business processes. Why do we want to have 500 doctors' offices doing 500 different billing things and having all of that management infrastructure cost associated with the delivery of care? So the inverted model is decentralized delivery, which is remote monitoring as part of it, and centralized financial services. That makes it efficient and effective and allows us to buffer the rising costs of delivering care. How about clinical risk mitigation? Those of us early on in remote monitoring recognize that there was a lot of risk in having data streaming from people's homes because there was no way to tie it to relevance. But if relevance and validity are enhanced, well then clinical risk mitigation occurs. If I can decrease the risk of a doctor receiving information from someone's home, then I create an environment where they're willing to engage rather than them to say, no, I'm not interested in that data stream, come to my office. So remote monitoring does 2 interesting things. It allows us to invert the delivery model to decentralized, and it helps us make rehab centers and orthopedic surgeons and internists. If there was a patient that came out of a motor vehicle accident, they would enter the churn on the right. Doctors, rehab, MRIs, lots of tests. And all those offices are performing business processes. Well, if you gut out the executive managerial aspect of that churn, and you pull out the technical aspect, the EDI, the electronic data interchange, et cetera, aspect of it, you can enable a very efficient system. Someone that gets whiplash or an injury in a car accident does not need to exist in that churn on the right. They can do a lot of it at home, and the business processes are handled in a centralized manner. Therefore, cost goes down, data efficiency exchange just goes up. And if we're talking about outcomes, that's a crucial element in that equation. So in conclusion, the current delivery model that's associated with care is not going to be easy to maintain. The centralized model of delivery and decentralized financial needs to be inverted. This transition is occurring, although it's occurring in starts and stops, but I believe in a coordinated effort. The business model and case will be made for it. Intelligent, relevant, and valid remote clinical monitoring. And please, I'm emphasizing relevant and valid data coming from the periphery, not just data coming from the periphery. And the intelligence is also that piece that allows us to mine the data. That's really the linchpin, I believe, for decreasing costs and allowing all of us to keep people at home that don't need to be in the hospital. We decrease costs, we deliver better care, we have better clinical outcomes at the right cost. And that's what we're all striving to accomplish. Thank you.
Dr. Grasso, could you go into a bit more detail as to what you're actually doing now at your hospital where you're at with remote monitoring. Have you implemented it yet? And what you see as a timetable.
Yeah, we're actually implementing and again, remote monitoring does not necessarily have to be just cardiac information, right? We all think of cardiac monitoring, but video data, biometrics, and a whole host of physiologic data is part of remote monitoring. So simply with motion sensing and voice communication between providers and patients, you're able to pick up a significant amount of valid information about one's state of being at the home. So we're implementing a network that will allow us to monitor through voice, through video, and through motion monitoring, seniors, the chronically ill, how they're doing in their homes, rather than them falling or having some other untold event. We'll be able to keep in contact with them more frequently so that we can intervene prior to them having a more serious decompensation of their clinical state. And that's what we're starting to roll out in northern New Jersey.
You have started to do that?
Yes, we have started that already.
Okay, good, thanks. We have limited time, so we want to leave time to allow the audience to ask questions as well. One of the issues with regard to remote monitoring is how do you get the information that you're monitoring to a central location? How do you literally transmit it? One way to do that is with Bluetooth, but is Bluetooth ready to do that? Dr. Michael Foley is the executive director of the Bluetooth Special Interest Group, and he's responsible for guiding the qualification and interoperability programs and the promotion of the technology, the specification publications, and the long-term roadmap of Bluetooth wireless technology. Dr. Foley, please.
Great, thank you. No, that's not. It's down there, but that's fine. I can use the keystrokes. All right, thank you, everyone. It's great to see you here. As mentioned, I'm the executive director of the Bluetooth Special Interest Group, and we're the industry organization responsible for Bluetooth wireless technology, which is arguably the most successful short-range wireless technology in the history of the world. Well, you know, that history doesn't go back real far as wireless technologies is involved, but, you know, still good to be number one. So we've been around for a little over 10 years now, and I'm sure you're all familiar with, you know, Bluetooth in your car, and you love it there. You love it when you're playing the Wii console and things like that. But you may be asking, well, Mike, you know, why are you here? Why are you at a digital health summit? You know, I see you're called Dr. Foley, but you're not a real doctor. You're a PhD. You know, what can you possibly add to the conversation here? Well, it's because in a Bluetooth SIG, we have over 13,000 members, and we do have that short-range wireless connectivity, and we go out and we work with our members to figure out, you know, what new areas, what new markets is the technology applicable for, and how can we best meet the needs of those industries. And one of the key ones over the last couple of years has been the health and fitness market. And we've really been spending the last 18 months or so laying the foundation for how Bluetooth can be effective in this market. And that effort was really culminated last summer with the version 4.0 specification with Bluetooth. And the key feature with that is what we call low energy Bluetooth wireless technology. And what that really enables is Bluetooth to be used in products, not just your phones and computers that you know of today, but these small sensor type applications. And those are going to be what you used in the pedometers, the heart rate monitors, things like that. And what Bluetooth really brings to the table is we're a royalty-free open standard, meaning any company can pick up the technology, use it, put in their products royalty-free. And the other thing, since we're an open standard, we're already in, you know, all the cell phones out there, we're in the personal computers, we're in all the tablets, so it's very easy to create